Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center, and I'm founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. This series is brought to you in part from a grant from the Rosalie and Sherry Exline Ziegler Fund. And tonight we're welcoming our guest, Erin Sawhill. Erin, welcome.
Thank you, Dr. Deming.
So Erin is a survivor of pediatric cancer, and Erin is a counselor, and she has a counseling service, Erin Sawhill, LLC. And we're going to talk about pediatric cancer, but then even more about what's it like to be an adult as a survivor of pediatric cancer. So welcome.
Great. Thank you so much.
And Erin grew up in Des Moines. I went to Lincoln High School and then was a Cyclone, Iowa State, where she majored in psychology and criminal justice, and then got her master's of social work at the University of Iowa.
Correct.
And several other counseling certifications to go with that.
Yes.
So before you had cancer, how would you describe your personality? So you were diagnosed at age 16. with an acute leukemia, AML.
Yep.
And so before you ever had cancer, what was your go-to personality? How would people describe you?
I would say I just grew up Des Moines, pretty active. My family was a couple generations deep in Des Moines, so very familiar. Grew up on the south side, active in church, active in school. So just kind of your normal.
Mm-hmm. How about extracurricular activities? What sort of activities were you in?
So
music or sports? Or?
Dabbled in dance when I was little. I went more arts and did some music. And
like show choir?
I did do show choir.
Uh-huh.
I'm having to reflect back. This has been a few years.
Do you remember any song you did in show choir?
No, I don't.
You don't?
I don't think we need to go with that.
Okay.
We don't need to go there.
I wasn't going to ask you to sing.
Okay. I was in the band, National Honor Society. I think maybe student council.
Okay. What instrument in the band?
I played clarinet at first, and then I switched over to the xylophone and was in the pit in the marching band.
Wow.
Yeah.
So, and the xylophone is considered like part of percussion, right?
This is true.
Uh-huh.
Yep.
Okay.
Yeah.
Good.
So
Cool.
I don't know. I haven't thought about that for a while.
So you were diagnosed with AML. Again, it's acute myeloid leukemia at age 16, which is a little older than most pediatric leukemias. Do you remember what was the first symptom that ultimately led to you getting tests that showed the leukemia?
Yeah, so there was a couple. So the summer before my junior year of high school, the one I remember first was I was at church camp and I would take naps, and that was not I was always jealous as a teenager that my friends could take naps. And that summer during camp, I ended up going back to my cabin and resting several times during the week. That was the first one. And the second one was into my junior year. I was getting a bunch of headaches, and I'd never had a headache. Went to the neurologist. They thought my backpack was too heavy, or I was just stressed. And so those were actually the first couple of symptoms that they kind of just, you're a teenager.
Mm-hmm. And then was it a blood test that led to you being told,
So then later around Thanksgiving, I had mono. And I was hospitalized because of my spleen being enlarged. And that was when they put me on steroids, and I was feeling great. I went home. For the first time, I was feeling more energetic and not so down. But they continued to do blood tests. And then that's when I was diagnosed. They did, the blood test showed something wasn't quite right. So I went back in for a bone marrow biopsy. And then that's what led to the diagnosis.
Do you remember being told?
Yeah.
You have cancer?
I do. In fact, I was diagnosed on December 23rd of 1998. And it was a normal day. I went out with friends. I remember I ate a lot of Milk Duds that day, which is very weird. And it was, I want to say, I don't know if it was a weekend or what day of the week it was, but I I got back, my mom let me spend a day with a particular friend, and they didn't want me to interrupt it. So we went to the mall, I ate Milk Duds, and then I got home in the evening, and she said I needed to go to the doctor. So my doctor met with me at 6:30, 7 o'clock at night, because they wanted me to have a normal day. And then the next day would have been Christmas Eve. They did admit me to the hospital, and then I started chemotherapy on December 25th.
Oh, wow.
So
Yeah.
that's, looking back, that's why they wanted me to have my whole 23rd to myself.
And do you remember your emotions when you were told you had leukemia?
Oh, sure. My first question was I going to lose my hair at 16 years old? That seems pretty vain now, but that was on the forefront of my mind. I just remember sitting around a table, and it was, am I going to lose my hair? Because that's what happens when you have leukemia. I didn't know anything about leukemia, that it was a, blood cancer. And I was very concerned about being a junior, and I wanted to make sure I graduated on time, and all those external things of like, this didn't fit into my plan.
And how about your parents? How are they handling it at the?
My mom's a champ to this day. She's a huge advocate in the community, and she, made sure that I had supports there with me. I went home that night, and she had friends already waiting for me. And that's just kind of been her MO all along. When I ask her now, she was a single mom, and she never let me in on any of the struggles financially, raising my little brother, who was 5 years younger, so he was 11. She just kind of showed up when she needed to. And if she couldn't show up, there was someone there in our support group.
And then going through the chemotherapy, how long of a period did you go through chemotherapy?
Sure. So my treatment was at Blank Children's Hospital here in Des Moines, which was wonderful for my mom and I, because home was down the road. So that is a luxury that I just know so many kids don't get. I went in on December 25th, and I do remember that first month, so a calendar month, so towards to the end of January, I was in for about 4 weeks straight, because, as you know, as doctor, the acuity of that particular cancer, that's why they had me go in December 24th right away. Didn't get to stay home for Christmas, is just how rigorous the cancer was going to be. So I stayed in that time for 4 weeks, and then it was hit and miss based on if I had fevers, infections, and all of those. Treatments started December 24th. I think final hospitalization was in April. Final treatment was around June.
Okay, so basically 6 months.
Yep, that's
of
right.
Treatment. And how did you handle school during that semester?
I'm not sure if this is still a thing, but I had a teacher at the school. One of my struggles as a childhood cancer patient was I did not want to see other kids ill. And so in my 16-year-old attitude, I made a deal that he could come to my room, but I would not go to his school. So he brought all of my school to my room. There's actually a Des Moines Register article on this.
And you're talking about
Mr.
the teacher.
Miller at Blank Children.
And so he would
get it from Lincoln, and then they would
so
he would be the teacher for the students. I don't know
gotcha.
if that's still
At the hospital.
Yeah.
So most of that semester you were an inpatient in the hospital.
Yep.
So,
and if I was at home, he'd just give me homework.
Gotcha. So you didn't actually go to school.
Nope.
So what was that like, being isolated from your friends, or did you have a group of friends that got to come to visit you?
Yep. So at Blank, the child life specialists were amazing. I add that because they kind of gave me ideas on how to integrate in my friendships. So I still have to this day hundreds of cards I got while I was in the hospital, many of which were from my friends at Lincoln. So I would go to school there at the hospital, and they would give me homework if I was at home, anticipating that I would have to have frequent visits at the hospital or stays. And so that's how I finished out my junior year. And When I was home, I could go visit schools if my numbers were up and my immune system was up. Otherwise, people came to me based on what my status was.
Do you remember what courses you were taking that semester?
They were so gracious with me. I mean,
Presumably not chemistry labs.
No. And I mean, walking around the floor for PE at the hospital, I remember that, which I skipped. I was really truant, if we're being honest, even for the teacher coming to my room. I want to say American history, some type of science, but let's just say they were very generous in their grading.
So as you got started the treatment, it was 6 months. Did you have a sense that it was all going to turn out okay?
There was one night that I remember. That was the only night my mom was called back to the hospital, and that was a night of question. I can't tell you specifically what was going on. I remember that they gave me oxygen, that I had x-rays in the middle of the night. Dr. Lonzarich, who ended up being my daughter's pediatrician when she was born, came. He was a resident at that time. And I just remember a different voice tone in concern that I had not heard from the doctors previously. So besides that night, I just felt really comfortable, but I can't even tell you what happened to then help. I think my numbers were just very low.
Very low. Yeah. And did you lose your hair?
I absolutely lost my hair.
Yes.
And it's not a problem now.
And how did you deal with that?
Okay. So I do recall going over to John Stoddard, and we looked at wigs, and I said, absolutely not. Those things are scratchy and itchy and heavy. So I wore hats the whole time. Unfortunately, I would not let people take pictures of me. And I have one picture where I'm covering my head. So really, I don't remember much about that piece of it. I have plenty of pictures with hats on, but I can't really picture myself bald.
And so you finished treatment in May or June. So you then were probably, by the time you started school again, in the fall of your senior year.
Correct.
You were
good to go. And I've known enough children with pediatric leukemia, and protocol for the ALL is years. And I went and I had my checkups every month, 6 months, year, 5 years, whatever it was. But I went in, hammered it hard, and got out. Didn't have time for that.
Right. So then what was your senior year like?
So I did not go back to marching band, but I think that was just a preference. I felt like I needed to just make sure I was grounded, and friendships and those kinds of things. It could have very well been to make up for lost time. And at some point, I just was doing college visits like the rest of them, went to visited Iowa, thought I was going to be a meteorologist, had a really cool psychology teacher that senior year, and that's what changed it and confirmed that I'd go to Iowa State.
And so you studied psychology and criminology.
Yep.
And so how did you end up in those two specialties?
So I will say, going back to my time at the hospital, my social worker was just amazing. And I remember days telling her that I would have her job sometime. And so that was in the back of my mind. And then I had this psychology major or teacher at Lincoln. That was great. And so that's where that came from. The criminal justice piece of it just came, I took enough credits that fell into place.
Gotcha.
Yeah.
And then you got your master's at the University of Iowa.
Yep.
And MSW, and then did you know as you were finishing college at Iowa State and then getting your master's that it was counseling that you wanted to do?
Yeah.
Because there's various different ways you can go with social work.
Absolutely. So at the time, Iowa State did not offer a master's of social work, and it was in an internship that I decided to go more the counseling route versus anything in law or those types of things. I just had a really great internship, got to work with a lot of kids at the time, their families, and just saw that there was a need there.
And I think you told me that you have done counseling with the children, mental health counseling for children, for adults. You also have a specialty of perinatal, where you work with parents, right before birth and right after birth.
Absolutely. Yep.
And how do you think your 6 months of intense medical treatment affects the way that you do counseling for individuals?
Well, I think just seeing, so even though I didn't go to the classroom at the hospital, I did see plenty of sick children. And what I realized is that no treatment was the same for any of us. None of, I'm sure there was others with AML or leukemia, but even then, you're on a protocol and different things happened, different age, gender, those kinds of things. And so I think that's where my passion for meeting people where they are and their individuality really just hit home, and being able to see people deal with things differently and support. Some people have it, some people don't. Some people fall into it naturally. Some have to work hard for it. And so I think I just wanted to present an opportunity for people to explore that for themselves.
What would you say if I asked you, what are ongoing issues that you're experiencing as a result of your cancer diagnosis or your cancer treatment? And maybe think about physical issues, psychosocial, emotional, financial, philosophical, spiritual. Do you think you're affected in any lingering way in any of those dimensions of your life because of the cancer journey you had at age 16?
Sure. So let's start with physical. I only had chemotherapy. I did not have to go through radiation. And of course, the whole medication regimen I did have. I did not have to have a transplant. We did talk to the University of Minnesota if that was going to have to be an option. They were there available for me. So really, in terms of long-term physical effects, I can't say that I have any. I do have a scar from my port. That's about it. As far as psychosocial, psychologically, I would say early on, whenever I had an appointment with the doctor, a sore throat, those kinds of things, and they would pull my blood work, there was always a fear there of what they would find. I wanted to know what my numbers and platelets and all those things were. It wasn't until family planning where I was concerned about fertility that I started to question maybe this is when I'll see some effects of it. I have a daughter. She's 6 years old and she's awesome. So that was not a concern.
And so you didn't actually have
I had
fertility
no
issues.
issues at all.
Yeah.
Thankfully, I'm just
Wonderful.
so thankful for that. Fast forward to after her birth, that's when I probably felt the most psychological effects. I have a couple memories at that point. Being sick as a child, my fear of relapse just intensified. I can think on 2 occasions that I drove myself to the ER because one time I was certain I had a blood clot. One time I was certain I had ovarian cancer or something. Like it just ruminated, and I had somatic complaints, overthinking. I was pressing things, so I convinced myself something was wrong. But I tell you, I made it to work those 2 days, even though I had
Even though
nothing
you were
wrong.
certain you had
I
cancer,
was certain. My biggest fear was that my daughter would not have a mom. Worked through some of that. I just couldn't keep going to the ER. It doesn't make sense. And so I had to stop and say, Erin, when there's an issue, then you can go to the doctor. Then fast forward to a month ago, and I am 40 years old. And was scheduled for my first mammogram. And I tell you again, it just played in my head. This could be the time that they find something. I got COVID. They prolonged the date of when I could
Delayed your
go.
mammogram
Yes.
until you're over the COVID.
Oh, it
and
was torture.
and
Yeah.
just the anxiety
Yep.
of that.
And I'm so grateful they did, because my lymph nodes were on fire. So they were going to have me come back. I went.
Unfortunately, the mammogram was.
It was clear. I didn't even get a call back, which they warned me. It's normal. It's normal. It's normal. If you get a call back, they want to be very careful. And so, yes, I have nothing ruminating in my head currently.
How about spiritually?
Spiritually.
Did your journey with cancer affect your view of spirituality, God?
Yeah, absolutely. I grew up in the church, and the community that surrounded me was just phenomenal. Not only for myself, but my brother and my mom. They just wrapped us in prayers and food and casseroles and their time and energy. And so, yeah, I mean, I couldn't have done it without my faith.
So I think I may be hearing you say that if anything, it strengthened.
Absolutely. And, going back to that one day in the hospital, that I questioned, is this going to be the day that I might not be here tomorrow? The doctors afterwards, I left this part out. The head doctor said to me, he's like, I can't explain. Like, we didn't think you were going to make it that day. And, I look back on that, and I don't think it was my time to go, and I'm still here. So, fast forward with that, I do struggle with, there's some very special, specifically little kids that didn't make it. And that's really hard for me, but I just have to have faith that that was in my God's design to.
And would you say these are little kids that you got to know in the hospital?
Yep. Yeah. Or through events as a,
but you know,
survivor.
by name and,
yes.
Yep. And so that the memory of them not having made it.
Yep.
It's
still, sad.
Still with you.
Absolutely.
Yeah. So you're a counselor. You understand the value of counseling. Did you have a counselor at any point during your cancer journey or after?
Yeah, I would. I've done therapy before, not specifically related to my cancer, but I will say that because of the supports I had, they gave me plenty of counseling. They just might not have been therapists, whether it's a pastor, a youth pastor, a mentor,
your nurse, your
absolutely.
Child life specialist.
Absolutely.
I mean, the counseling comes in many different forms.
Yep. And I do remember in the hospital, I was on an SSRI for anxiety, obviously related to the cancer. And so I feel like they did a good job of not just treating the cancer cells, but the whole body piece of it.
Yeah. And for those who don't know, SSRI is a form of antidepressant. For treating depression and anxiety. What would you, when you think back on the journey, the treatment, those 6 months, anything that stands out that you wished would have, that you would have received care in any sort of different way? Anything that it sounds like you had just wonderful support, and it wasn't just treating the leukemia cells, but you had wonderful support all the way around. Any aspect of the care that you've?
I mean, I've even gone to Blank since then. And back then they had a nurse's station and the rooms surrounded it. And I had a room that looked out to the nurse's station so I could kindly yell for my nurses. And now they're in rows. And I'm like, I had it better. And that room was reserved. If there was someone in it when I got there and they discharged, they would still move me to that room. And so I can't honestly think of anything that, and even when I think back to my experience at the hospital, I know I had bad days. I know it, but thankfully our brains want us to heal. And so I think more of the funny jokes and some of the random things I did that uplifted me. So, yeah.
So, as a childhood cancer survivor, you often will continue to go back to the childhood cancer specialist for a long time.
Yes.
So, how long did you continue to go back to the pediatric oncologist for follow-up?
So I graduated Lincoln. I went on to Iowa State, and that's where during that time was where I had those regular checkups for a year, 2 years, 3 years. I graduated from Iowa State, was still going to Blank Children's Hospital, and I asked them if I got my master's, if I could continue. And at that point is when they said that I needed to part ways, and they referred me to John Stoddard. I went one time and he cleared me until.
So you're probably in your early 20s when
Yeah.
you were actually released
Yeah,
from
I'd say
oncology.
probably 23, maybe.
Uh-huh.
Yeah.
Uh-huh.
Yeah, I got my money's worth at Blank.
Okay. And do you have a primary care doctor now?
Yes, I do.
And is that an internal medicine doctor, family practice?
Internal med.
And does your cancer history factor into your conversation on a yearly basis, or any special testing that you get done on a regular basis?
Nope. She's very well aware. I had a different doctor during my pregnancy, and he or they had me check in with a hematologist due to the leukemia to make sure I have family history that needed to be looked into in terms of blood clots. And so they kind of collaborated, maybe a little more so than they would have for a lay person.
But as it turned out, you had a normal pregnancy.
Yep. They had me on a
healthy daughter.
Yep. Yeah, it was great.
Good.
Yeah.
Have you had the opportunity as a professional therapist, counselor, to counsel patients with cancer?
Sure. Yep. I have a couple currently that I'm working with. I have one, a pediatric cancer survivor. And these are ones I can just think of right now as we're talking. I have 2 adult women who are cancer survivors. And then I have a family of a cancer survivor that she was just in the last year went through treatment.
And how would you say your own cancer journey affects the way in which you listen to, counsel? Do you share your experience with patients?
There's definitely discretion there. With all of them, I would say I probably ask different questions than maybe other people that haven't gone through cancer. Tapping into things that I know may affect me, or did affect me that they other people wouldn't know. I'm trying to think. I do believe all my current patients know that I've had cancer. To what capacity? Not very much, but they know I'm a survivor.
Yeah, and that can be, I think, comforting and sort of this kind of a bond.
Absolutely.
I mean, just like
sure.
I grew up in South Dakota. You meet someone from South Dakota, there's sort of that bond, and same with shared experiences, and you don't always have to go into great detail.
Absolutely.
But as a professional counselor, therapist, what do you see in your patients with cancer that are some of the issues that they come to you that's directly or indirectly related to their cancer?
I would definitely say for my adults, that fear that I experienced, once you become, and these women are parents, once you become a parent, you're more worried about your kiddos than yourself. And so what would relapse mean?
So fear of relapse and the implications of, oh my gosh, if I'm gone, who's going to take care of my kids? And I'm not going to see them graduate. I'm not going to see them get married. I'm not going to see my grandkids. So that whole fear of recurrence, it just can snowball.
Yep. And then any somatic complaints, what does that mean? I already said, I definitely can relate to that. And we can get in our own heads and create more issues.
What sort of theories of therapy do you adhere to? What are the style of therapy that you find helpful in general, or maybe more specifically, let's say someone who is cancer-free but has fear of recurrence?
So, basic talk therapy, which we would call cognitive behavioral therapy, thoughts, feelings, actions, and what you do with those thoughts. More recently, I've been trained in EMDR, which is eye movement, EMDR, desensitization reprocessing. And so that is a very different look. It uses the two sides of your brain, and you can tap into bilaterally breaking through the patterns that have been created by fear, through a bilateral stimulation from going from your emotions, so this fear, to the logic that can help heal whatever the misconceptions are that you're hanging on to.
So I've heard of EMDR,
Yep.
and but explain a little bit. Actually, how do you do it? Well, I'll let you
Yeah.
explain it.
Yeah. So believe it or not, I've had EMDR done on public speaking. So let me tell you about my experience.
Okay, so you were the patient,
It was the
and you
patient.
had a therapist who did EMDR on
This is
you
true.
to help you overcome fear of speaking.
This, yeah.
Okay.
Mhm. Okay. So
I think it worked.
I don't know. I got a little hung up there a minute ago. So it's 8 phases. You talk a lot about prepping yourself, relaxation, your resources is what we call it. And then what I'm used to is talking one-on-one, which is fine with me. It's groups that I struggle
It's
with.
just you and me here.
Yes.
Just you and me. Nobody's watching.
And so you take whatever negative thought you have, and it's been found, Francine Shapiro, that if you do something bilaterally, so I'm tapping right now, I could do your eye movement, that as you're processing, thinking about it, you break through. So I say, I don't like public speaking. It makes me feel unworthy. I have nothing good to say. It will break through that into the, well, Erin, you went to school for a lot of years. You have clients that find value in what you're saying, and you can hang on to the positive of I'm worthy versus I'm unworthy. And it's through the bilateral stimulation, our neural pathways get in the pattern of being stuck on the feelings of things. I'm unworthy, I'm unworthy, I'm unworthy. And as you process it and let your brain do the work, so I'm not talking during this process with my clients, I'm letting them do it all. It will get into the, oh my goodness, this goes back to being 5 years old, not picked for a Christmas pageant. That has no value to you now, Erin. And so it's really cool.
Where does the eye movement come in?
So as you're talking, you're doing the bilateral stimulation.
Okay.
As
And
they're
so
processing.
if I'm the patient, I would be following
This is true.
your finger with my eyes, and
Yep.
the movement of the eyes somehow breaks
up the neural pathways.
Okay.
Yeah. Yeah.
Yeah. So we had a conversation a few weeks ago about psychedelics, and
Yes.
this thought that as children, our minds are just open to all sorts of pathways,
Sure.
but that as we get experience, we end up doing things the same way, and we get these rigid pathways in our brain
Same
that we're not
concept.
using as much. So
Yeah.
that's what I was thinking,
Yeah.
that you're sort of trying to get the brain to do other things than
to break up.
just have that habitual, I'm not a public speaker, I'm bad at it.
Mhm.
And you're just
Yep.
getting your brain to.
And they find that the faster you I tap, I don't do the eye thing. I think that
Gotcha.
looks
So
that's scary.
So eye movement is just one thing, but you
Yep.
can do other things physically.
Anything
Just
that
to,
you can do, there's and this is really, I mean, you can use this for any type of trauma, big trauma, small trauma. There's these hand like stimulators that you can put in your hand and it does it for you. There's noises, anything bilateral. But the faster you have your stimulation, the more your brain will break it up. And so, but during your resourcing, when you're trying to calm down, you do more of a soothing, relaxing tap. So even afterwards, a client can just, they're in a high stress situation, you can just sit subtly and do it. But I encourage my clients, don't do it too fast. Otherwise, you could start to get your the stimulation going, and you might not be in a place where you want to stimulate.
So once you have taught your client this, they can then do it on their own.
Mm-hmm. Yes, it's not recommended necessarily. The resources, so the relaxation point, I'm worked up and I know that I need to soothe myself. I can do it softly or slowly, but not fast, because then you'll stimulate and you can go back into some of the depths.
So we started talking about this when I asked you what are various theories of therapy that you utilize. When you first meet, let's say you're counseling a young adult, let's say 30, who had cancer, whether it was pediatric or cancer at age 25, and is cancer-free, but really struggles with that existential issues of fear of recurrence. How do you approach?
Well, in some of it, I don't necessarily think it's a therapy per se, but just working on the mindfulness. And I know something that cancer has done, and I'm not proud of it, is that at times it stole my joy or opportunity, and it's kept me from doing things. One thing that I didn't do for a long time was own my survivorship. Like, I didn't want to come to groups. I didn't want to talk about it. I could tell my story, but I don't want to see cancer survivors. That means that they've gone through it. And I realized that that is not giving me community, nor am I making myself available to that. And so just working with my clients on, besides the actual cancer, to your point, spiritually, physically, what's stopping you from being present today? Yeah.
How do you think your life is different now as an adult because of your cancer journey than it would have been had you not?
I think, although by nature I'm an anxious person, I think maybe I try not to get hung up on things of the world. I love to travel. I love to try new things. I try to not just stay in a box, and that I don't know that my personality would have allowed me to do that in the past. I did, someone asked me to come to their cancer survivorship group as a professional, and I had these happened to be, I believe, all breast cancer survivors, and we sat in a group, and the exercise was for them to just write down the feelings related to cancer. And of course, at first there was very negative, and I did it myself, and I started writing down some very positive things, like I feel strong, I feel, grateful. And once I modeled those words, these ladies were able to do it too. And I just think some of the strength, the reaching out, asking for help, I don't know that I would have done without my cancer.
Yeah. And, I've been around you. I see, just kind of repeating what you've said, that you've gotten through this, which gives you the sense of your own strength, which is what, we call resilience.
Yeah.
That
absolutely.
when you go through a difficult time, especially with all the support, you actually come through that, not with post-traumatic stress, but actually with a greater sense of your own strength.
Yep.
And then you also, as you pointed out, the gratitude you have for everyone that helped you on your journey. And then I've seen you and your mom paying it forward. Like, okay, we had all of this support and came through successfully.
Sure.
Now we want to use our talent and wisdom to help others that are on the journey. So those are things that I've seen.
Oh, thank you. Yes. I I get some of that from my mom.
Yeah. Any other reflection that you might have on the way that your cancer journey has influenced your life?
No, I just think back to a book that I use in my office by Mark Brackett. It's called Permission to Feel. And just allowing myself to, if I'm having a bad day, it's okay to call it a bad day, but I don't have to let that permeate into other areas. If I have gratitude for my cancer, that's fine too. It brought me so many cool people and experiences and those kinds of things too. But I think people get hung up on cancer is so bad. It's horrible. It is horrible, but the experiences aren't necessarily horrible that it offers.
Yeah, the life experiences
Mhm.
that it's given you. Where do you see your career going in the next 20 years?
My career going in 20, that's a really good question.
So let's say you retired at age 65. You still got 25 years of
Yeah.
your career. That's a lot.
So every couple of years, I take on something new. So it was perinatal. More recently, it was EMDR. I'm not sure if you are familiar with the Enneagram.
I am.
Oh, I
yes.
love.
Okay.
That's my
So
thing.
lifelong learning. So you're
Yep.
picking up new
And
techniques that you can use.
So trying to just make myself more education. I want to learn more. I want to learn more and have more to offer. But then I have been considering looking at what does this look not just outside of my office, but in the community for larger numbers.
Mhm.
I have to get over some of those fears first, but I'm getting there.
You're good. You're good. You got it. Yeah. Well, tell you what, let's open it up for questions, okay?
Sure.
You ready?
Sure.
Okay. So we've got a live studio audience here, and we've also got people that are watching live streaming. So those of you that are watching us live, you can put questions in the chat box. And
Yes, you said when you first spoke with your doctor, you said you had cancer, and your first impulse was, "Am I going to lose my hair?" At what point did you ask yourself, "Am I going to survive?" Or did that happen much later? Or did he tell you your survival rate is X? And
That's a really good question. I think that just shows that I had an attitude of, although I feared it, that I think I thought I would come out of it. I just go back to that one night that I have to always admit that wasn't always the case. And there were really hard days. But I think that first night, that was a fear of what does this look like, not only for my life here, but, so with AML leukemia, you can help me with this. It's not as common for children. And so I was in a protocol more driven towards young boys. And there were points in my treatment that they were just kind of on a whim. There wasn't a protocol for it. And so that was more concerning for me. I didn't talk about the fact that at the end of the treatment, that decision was made by my mom and I to end treatment. We literally got to a fork in the road. They pulled my name from a hat on whether I would get more treatment or not. And I had been so sick with the treatment that the risk was far greater with getting more treatment than it was to stop treatment at that point. And so, but I just think my faith had to have, to answer your question, had to have got me through some of the big questions on what does this look like?
I kind of wonder, and I'm not trying to tell your story, but the way your doctors that first night when you went at that evening, December 23rd, sort of portrayed here's the path, and the way your parents projected, your mom projected positivity, that it probably, they didn't maybe have to say, well, it's 98.2% curable.
Yep.
It's just the way in which the news was given to you and the plan of here's what we're going to do. And you came with the sense of, okay, am I going to lose my hair? But
right. Well, and to that point, I was a child. I was 16. I mean, I was a good student, got good grades. I was smart. But my mom, she's the one that had to ask all those
Yeah,
questions. And
yeah.
my guess is, looking back, that she's the one that knew all that information, and then they chose if it was appropriate for me or not. So the value of being a kid, my mom was my buffer.
I wonder at age 15, I think back when I was 15, I probably did not know any child that had died of cancer personally. So
No. And, when you, as a 16-year-old, my thought was only about the vanity behind it, because that's all you really know at that point. You don't know kiddos that have had it. And, the adults that do have it in your life, they all lost their hair. And,
Yeah. Okay. Other questions?
So you mentioned, and we talked a lot about fear and how powerful that is. Is fear itself a negative as far as cancer recovery is concerned? Have you seen that? Does it have a negative effect on the physical recovery of a cancer patient, or can fear actually make you survive because you're afraid of dying? It's kind of an odd question, but you know what I mean?
Hold on, I have to think on this, because you're speaking to something I had considered. A lot of times society uses the word anxiety, which can mean worry, fear, anticipation, and it would be irresponsible of us to not have some point, some type of concern for situations. So I don't know that it is always fear, or bad, but it can lead us to other questions. And, so if we're fearing, what does this look like? That will challenge us to look at who's our community and who's our supports and who will be our go-to. And so, it makes us ask very relevant questions.
Yeah. I would just maybe share. So, for example, I think fear by itself is not a bad thing. I mean, fear says, "Hey, wake up! There is something here that needs my attention." So, let's say you are mountain climbing and there is a fall of 1,000 feet, and you're going to have to take this step over. No, everybody's going to have fear there. Fear is saying, "Pay attention. There's danger here." And can be a source of creativity and ingenuity in how to move forward. And perhaps anxiety is in some ways telling you, pay attention. There's something going on right now, and can serve as a wake-up call. Obviously, you don't want to be incapacitated by fear, and you don't want to be incapacitated by anxiety. But to the extent that fear or anxiety makes you aware of a situation that you can then move forward to deal with it, I think it can be a positive thing in waking you up to something that is creating that fear or that anxiety, as long as there's a positive way to move forward.
And if it's unhealthy anxiety, and maybe this is your question even more so, is can you turn that anxiety on and off? Is it consuming you? Is it stopping you from doing things? Is it interfering with your work, your family? Then that's when it becomes the negative.
That was kind of the next part of the question, the negative thought aspect. I know some cancer survivors, even though they may be ill, you ask them how you're feeling, they're feeling great. You ask them what the negative prognosis for their condition, there isn't one. I mean, it's almost like a mental game, but it isn't to them. I mean, positivity is a big part of this, and they will not entertain a negative thought. They won't even have it in their lives. And is that beneficial?
I would say that there's some hormones, cortisol, you hang on in your midsection. Then that's not healthy, and it can definitely have negative health effects. And then, there's some positive endorphins in there that the more you have of them, serotonin and those kinds of things, can definitely set you on a better trajectory.
Yeah, I would say that, always portraying positivity. I mean, I know people that, I mean, I'm like to be that way. You ask me, how are you feeling? I'll say, great. But, I think it's not possible to be human and not entertain some negative thoughts. And you may not say that to people. And there may be select people that you share your negative or your downside with. But yeah, I can't imagine that you can be a human being going through life with all the bumps that you're faced with without occasionally having a down day.
Sure. Something I was thinking about also was, cancer, dependent on your situation. I was in Des Moines. I was literally 5 minutes from my school, my church, my home. It can be so isolating and lonely. And, there are studies that show that loneliness is so bad for your health, mind, body, and spirit. And so, yes, if you have to hang on to that all yourself, it can be quite a bad place.
So I have another question. Did you have any metaphors for going through the cancer journey? I mean, different people use, a battle, a fight, Pac-Man cells going through your bloodstream, gobbling up cancer cells. Did you have any particular metaphors, or did you use any visioning in a way that was helpful?
So, not exactly.
Okay.
Two answers to that question, though. My mom's dear friend was slated to do a Leukemia Lymphoma Society marathon January 6th of 1999. So weeks after I was diagnosed. She did not have an honored patient at the time. She just signed up for it, and I was diagnosed 2 weeks before her race. And so when she came in and she told me that I'd be her honored patient, I said that I was going to run that same race. And sure enough, January of 2006, I ran the Disney Marathon.
Wow.
Yes. And so that, I think, was just, I guess that was my metaphor. I was going to run the race and I was going to do it.
Just one more step. More step.
You gave me a metaphor several years ago, and you don't even know this, that cancer is a mountain that is put in front of me, but then I get to choose all the other mountains ahead of me. And I hope to one day do Kilimanjaro with you, Dr. Deming. But with that said, it's not just the physical mountain of Kilimanjaro, but it's any of these things that are scary or new adventures that I get to choose that now.
Right. Sometimes a mountain just drops out of the sky unasked for, like a cancer diagnosis that you need to climb. But sometimes you intentionally put a mountain in your pathway.
Yep. Yeah. Whether it's, the Disney marathon that I was going to do or whatever is before me.
Beautiful. Beautiful. Yeah. Other questions for Erin?
So with, I believe I'm saying this right, EMDR, with that, after a while, could your patients, after practice, could they use it on anxiety or the fears?
Sure, absolutely. Yep. So any repetitive thought or feeling you might have. So for instance, my fear was public speaking. I have people that name, I'm always sad, like I'm broken, and some of those things. So that would be alluding to depression. I can't do this. This could be getting on an airplane, any of those types of things. So, yeah.
Very good. Well, Erin, this has been just great. And the time went by and you did a beautiful job of public speaking. So,
okay. Thank you.
This was great. This was a lot of fun. I've enjoyed this conversation a lot. So
thank you so much.
Yeah, good luck to you. And I just really admire all that you've done. And I really am glad that you have embraced your cancer survivorship and using the wisdom that you have gained to help others along
Sure.
the way. That's really what it's about.
I appreciate it. And I appreciate Above and Beyond Cancer and their mission. And more recently, I've thoroughly enjoyed the young adult.
Yeah, the AYA,
Yeah,
Adolescent Young
yes,
Adults.
yes.
Thanks for being part of
Yes,
that.
yeah.
So thanks everyone for attending this evening. If you know someone that would benefit by listening and watching this program, it will be available on demand at the Above and Beyond Cancer YouTube channel or the Mercy Cancer Center website. I hope you'll come and join us again next week. Thanks, everybody.